go ahead and get started for today, and we'll just kind of let people in as they join. Thank you guys so much again for joining for HHIE's Community Forum. I am so excited to bring these back, and for provider services today, we're going to be highlighting a few different things. So I'm going to go over the agenda really quick. First is going to be just some welcome and introductions. I may look familiar because I've been doing trainings for a while now with HHIE, but just kind of welcoming and kind of doing some introductions for me and Jackie, who are hosting today's event. And then we're going to be going into who HHIE is and what we do. We have a lot of services we offer. And then some helpful resources that may be available to a user, or maybe even a point of contact if you're joining today as a point of contact. I will be doing a community health record demo, which is a demo of one of our tools that we have to offer. So it'll just be a quick, it's not a full training, it is just a demo of the most used features in that tool. And then Jackie will be doing a Reg Pass review. So the registration pass system is a point of contact tool, so she'll be doing a review of that as well. And then we'll be ending today's session with a Q&A and just some closing information. So just a brief introduction about us. I'm Clarissa. I joined HHIE back in February of this year, and I think I mentioned it before, but I do probably look familiar to some because I do host all of our community health record and notify trainings. So I come to HHIE after a lot of clinical background. So I've been in healthcare for 17 years. I started as a CNA when I was just a senior in high school and served as a pharmacy technician through college. I worked as an RN in med-surg and ER. So that was my clinical background for my undergrad, and decided to pursue a graduate degree as a family nurse practitioner. So I've been an NP for 7 years. I've worked in acute care, started out in urgent care, and then I moved on to family practice. And then I finished out my clinical NP experience with 3 years of pediatrics. So pediatrics has my heart. I realized that was my favorite thing, and I've gotten to use that background with HHIE, so it's been really exciting. I love, if you've done a training with me, I really tailor my trainings to fit the user, right? So I get to know who it is I'm training, what organization, what their workflow is, and really try to tailor my trainings to fit their workflow. And so that brings a unique perspective to that, because it allows me to really go into specifics and find what works best for the user. And I'm so excited to be a part of HHIE. I'm going to bring it over to Jackie and let her do an intro.
Everybody, I'm Jackie. I'm also with HHIE. I joined in July, so a little bit after Clarissa. I'm a speech therapist by trade, so I spent about 10 years doing that, primarily in acute care, geriatrics, but a little bit with pediatrics. And in addition to my clinical, patient one-on-one kind of things that I did, I also worked on the admin side. I was the admission director of a nursing home here in Hawaii for a little bit. So I have an understanding of transitions of cares, prior authorizations, and kind of going through the system. I spent, 7 of my years here in Hawaii, so I feel familiar with some of the hospitals here and some of the SNFs and long-term cares. What I did as a clinician was I really tried to empower my patients to make decisions on their own. So when I approach my position here at HHIE, I really strive to be a resource. A lot of what I do is behind the scenes. I help add users and give you your passwords and your usernames and that kind of thing. But I'm also looking for solutions. So if there's ever a problem, I aim to be that resource that people can come to me and ask, and I can figure out an answer if I don't know it. Additionally, I am always trying to find ways to improve the user experience and make sure that people can maximize what they're getting out of our services. I'm going to pass it back to Clarissa for the rest of this.
Yeah, so happy to have Jackie on board. I feel like it's been such a breath of fresh air since we onboarded her, and it's been, I think, full throttle since we onboarded you back in the summer. So we've made a lot of strides. If you are familiar with our LinkedIn page, if you saw that, and that's why you're joining today, that was all Jackie. And we've really been able to get the newsletter up and running, and hosting these community forums, having a team has made a big impact in our outreach efforts. So excited to have her on board. So going into who is HHIE, right? I get asked this a lot. We've been attending conferences a lot lately. So if you stop by our table, I love getting to talk about who we are. So we are Hawaii's Health Information Exchange. We are the state designated health information exchange. And if you're familiar with what a health information exchange is, then you know that we have data sources from multiple EHR medical records resources, and we connect those into one single source. So you don't necessarily have to use the same EHR platform. For us, we make those connections so that you can access those medical records across multiple sources. And we work in a full TPO, treatment payment operation model. So we are there for healthcare providers, hospitals, stakeholders to securely share those medical records. And then you can access the patient records through our care services. So our services that we offer are the community health record, which a lot of people are familiar with. And if you've done a training with me, then that's what we've been highlighting mostly is the community health record. That one is for providers and, again, full TPO model to be able to go in and search for their patient and see those medical records, whether it be labs, radiology, pathology, medical record reports like ER discharge summaries, inpatient discharge summaries, consultation notes. It has a medication feature where you can query the ambulatory medication fill history. So you can access those through our community health record. One of our other tools, and I actually lead the training for that one as well, is real-time alert notifications, and the tool's called Notify. It works in collaboration with the community health record. So I'm going to use the example as like a private practice. If you have a private practice and you say, this is my panel of patients, right? Let's say it's 100 patients. Obviously panels are way bigger than that, but I'm just using this as an example. But if you have a panel of 100 patients and you say, I want to be alerted whenever these patients are seen, whether it's, you may want to turn on if they go to the lab to get a blood draw, or maybe you want to be alerted when they're seen in the ER, or a discharge from a hospital, transferred to another facility. And then obviously the last, which, obviously is something we would want to know too, is the unfortunate event that a patient death occurred. So those real-time notify alerts can be set up and can be sent to you. And there's multiple different ways that tool works. You can set it up as just coming into the Notify portal. So it's a login you're given, and you can see those notifications. What I love about that is the Notify tool is real time. So that means that we aim to strive for 10 minutes. So within 10 minutes of that event taking place, that provider or that staff member who's following that roster can be notified on that event taking place. And so you can go in and you can see that through the portal. You also can set it up to receive SMS text alerts and or email alerts. If you want to be notified right when it happens, you can do it that way. Now, SMS text and our email capability does not include PHI, right? We want to protect that PHI. And so therefore, if you set up those, it'll just say one alert, patient admitted to the hospital or patient discharged. So then it'll prompt you to go log into the portal to view that alert. We also have direct secure messaging, which is listed on there as well. If you have that set up through your own system, you can use that direct secure messaging, but we offer a tool as well that allows you to set up your own DSM through our portal. DSM and the work list also allows you to see PHI. So if you did want to receive those alerts through a direct secure email, then it will include the patient's PHI. The other tool is bidirectional data routing. And so that one, pretty self-explanatory. Obviously, if you are an organization that practices in clinical setting, you can share your clinical data with us. We can set up those data feeds so that your data is on our system. And then we can also route some of our clinical data to you, whether that's labs. We have a lot of ADTs that we route. Those are admission, discharge, and transfer notifications. We do have some limitations to our data routing. For instance, CCDs, our continuity of care documents, those currently can't be routed, but it is something we are looking to expand in the future. But we do have that ability to route that raw clinical data to you if that's something that interests you. So really excited to really highlight, I think everyone's so familiar with the community health record and how vast we are. However, there is other sources of services that we offer. And so excited to bring those to light in this training, or I guess more of a forum. The next thing is the helpful resources. I think 3 of these things are actually in the meeting invite. So if you registered to view this, it is in the meeting invite. First is the data sharing partner matrix. This matrix is updated periodically when we onboard new organizations, and I'll be showing that in just a moment. We just updated this in September, so it's very up to date with current information. This PowerPoint is also available in the meeting invite, which does have direct links if you do want to see those. The community health record tip sheet is also in there. This one is an amazing resource. I provide it at each one of my trainings in the invite details. I love this because even I used it when I was first new to HHIE and I started training on my own. I literally would have it on my secondary screen, and I would use that as talking points because it's very well organized to go through each one of the features of the community health record. And it highlights maybe some questions that, are whether frequently asked questions or maybe just some navigating tips to use. So I really enjoy that. And then Jackie has the Reg Pass tip sheet as well, and she'll be doing a little demo on that. So we'll go over that as well. The YouTube channel link does have some links to short little clip videos of resources, whether it's for the community health record or for Notify. So if you're interested in checking those out, I will kind of put a plug in there to say, they're great resources if you just want to learn some more information. But if you are onboarding, if you're adding new users, or if you just need a refresher, I highly recommend reach out to me and schedule one-on-one trainings because, as I mentioned before, those training specific workflows make a big difference in your user's experience and navigation and really maximizing their time, because we all know the time is so precious. So I am going to highlight one of those documents, and that's going to be the data sharing matrix. And this is a great resource. As I mentioned before, I do put this in all of my training invites, and it is in the meeting invite today. It's on our website. This data matrix really highlights all of our big participating facilities on the left-hand side. When we updated this in September, it was because we added Hawaii Diagnostic Radiology as well as the Cancer Center of Hawaii. So they're onboarded as new data sharing partners. And so we update this as new data sharing partners come aboard if they're a large facility. We also have about 200 independent practices sharing data with us, and we are working on a matrix for this as well. And of those, some use an EHR system called Elation. So excited to show you what that data, where that's available at. So if you go through the columns, you can see the types of clinical data that you may see. So demographics, these are the ADTs, admission, discharge, and transfer messages. We have labs, pathology, radiology, and transcription reports. And then our medication fill history is done from a vendor called Healthcare Systems, and they provide that ambulatory medication history. And I'll show you how that looks in the system as well. The legend at the bottom of the screen shows you where that clinical data is found. So if it's blank after their name, the clinical data is going to be in the results tab. So that's Queens, Castle, HHSC East, HHSC West. We also have the Cancer Center of Hawaii. Our clinical labs, diagnostic labs, and Hawaii Diagnostic Radiology is here as well. And then those Elation private practices. If they share clinical data with HHIE, then their clinical notes are going to be in that results tab as well. If a facility has an asterisk after their name, that's going to be HPH, Kaiser, VA, DOD. We also have Maui Health Systems. We have Kahuku Medical Center, Rehab Hospital, the Pacific, and love that we have a federally qualified health center and hoping to onboard more in the future. We have Molokai Community Health Center as well. So excited to have those, and those are found in the Documents tab. And this is an area where I feel like most users, when I conduct refresher trainings, they miss how to pull that clinical data in. So I'm going to be highlighting that today. And then there is one, HHSC Kauai. Their clinical data is actually found in both tabs, so they have 2 asterisks after their name. So refer to those. All right, I'm going to be doing a community health record demo. And I already have conducted, I've already logged in, I've already done a patient search, and today's training is actually with a test patient. And because we want to protect PHI, we're not using a real patient today. This is just a test patient, not anyone that's real. And you can see here, I've already conducted the name search. So you search your patient's name, and you're able to click right into the patient's chart and access that clinical data. Now, this is not a full training, as I mentioned before. I do recommend if you want a full one-on-one or maybe a group training. If you're here on Oahu, I can schedule that in person and we can get that set up, or we can schedule it virtually via Microsoft Teams or Zoom, whatever fits your needs. And that would go into specifics where I find really good patients to show you clinical data, how to navigate, work with your workflow. This is just to highlight those big areas where you can find clinical data. So the first is going to be the results tab. So over here on the left-hand side, always use the left-hand bar to navigate through. The results tab, again, if we're referring to that data matrix, the results tab is where you find clinical data from those facilities without an asterisk: Queens, Castle, HHSE East, HHSE West, clinical labs, diagnostic labs. And it's really great to see this feature work because it's very sortable, searchable, and easy to navigate through. The dark gray bars allow you to navigate and search through these areas. You can use the tabs. So if you deselect all, you could potentially select and only see certain clinical data that you want to see. And then you can also use this little search text feature to type in certain keywords. Maybe you're only looking for a specific study and you want to open those up. This area highlights all of those rich details that you can pull in. The other area is going to be the Documents tab. The Documents tab, this is the area I mentioned that a lot of people overlook when I'm doing refreshers. So these are people who've been using our system for multiple years, and I come in and I offer to do a training, and they'll be like, all right, fine, we'll do it. And then I'm like, I didn't know that was there. So it's always great to really see this in action and be able to show this, because a lot of people miss this spot. So I actually have this in a way to show you through screenshots, because you can't query in meds from a test patient or documents from a test patient. So you would follow the little blue buttons. So you hit Find External Documents. Your patient would display here, and you would click the little check mark indicating this is your patient, and you would select Find Patient Documents. Once that search has happened, it's a query and retrieve, it's going to pull it in. You can see here that we've got some details listed below. So this is HBH, Kaiser, VA, DOD. We have Molokai Community Health Center, Rehab Hospital of the Pacific, and Kahuku Medical Center, as well as HHSE Kauai. Their clinical data comes in this way. So you pull in those clinical documents and you select Load Selected Documents. And now you have a list of all of those continuity of care documents that you can review. And when I do trainings, I go into specifics and how to use this particular section to navigate through and find what you're looking for. The other tab is the medication query. The medication query can be run once every 24 hours, and you can see it's blue. So if it's blue, then that potentially means that you can run that medication query. And that one I also have screenshots for. So the medication query, you select the blue button, and now that medication query will run. What I love about it is that you don't have to sit and wait for it, right? So if you come in and a medication query is something you really need to run, I highly recommend coming in first, go straight to the medication tab, query those medications in and pull those in, because it will still run for you. If you go to the results tab or you go and look at a face sheet, that will still run in the background. The medication query populates at the top, indicating that it is complete and done. And now you have your medication query. You're able to see the medication, the strength, the pharmacy, who prescribed it, and the patient's last fill. It's important to note that this pulls from the date of the query and does a 12-month look back. And I have been impressed with this system. I will say a lot of EHRs now have the capability to run a medication query. However, anytime I've done these trainings with people, they will tell me that this pulls in way more information than their EHR's medication reconciliation, just because of how robust these data feeds are. It pulls across the US. So it pulls, I've seen mail order pharmacy, which the military uses a lot. DOD, I've seen Tripler Medical Center, I've seen VA medications, I've seen like Costco, Safeway, CVS, I've seen KTA Pharmacy, 5-minute pharmacies, the big ones, Longs, all of those as well. But just kind of even those smaller independent, I've still seen it be able to pull in all of those really great clinical medications. And then if you see below, if you open up that little plus sign at the top, it not only shows you that, but it'll show you the day's supply and the quantity that the patient was given. One of my favorite features, and I can't show you in a test patient, but if you print that medication reconciliation, it's actually a workable PDF that allows you to edit on it. So you could write how, if you're talking to the patient, are you still taking this medication? Yes or no? How do you take it? Do you take it once a day, twice a day? When was the last time you took it? That's why I love it, because once you do that print option, you're able to really use it to, even if you were in front of the patient. So the medication query. And then the last section I like to highlight is the profile and face sheets. So it's up here at the top. And profile and face sheets, I usually skip demographics and go straight to face sheets. When I teach this area, it's not populating for this test patient. So face sheets are really great. Let me try something really quick and see if I can't pull that up. It should populate. My apologies, everybody. There we go. Okay. So the face sheet section is where you can see real-time ADTs, right? So those alert discharge transfer notifications, and that is in that second column on the data sharing matrix. So you can get really key information about your patient's care. If you go to the second tab in face sheets, the most recent encounter is going to show up here at the top, and you can get some of those details related to that individual visit. I can see phone number information. Maybe you're trying to reach out to the patient, but the phone number you have on file isn't working. You get that visit summary details. When were they admitted? When were they discharged? You get key information. You can even see down to the room and bed number where the patient is located. You can get care team information, emergency contact information, and at the very bottom, it will populate with the patient's insurance information. So not only can you see, and it can populate more than one, it actually can populate up to 3. So if you have a patient who's got more than one insurance, that will populate there as well. So these are just some really key things that I focus on when I'm in training, and key areas that I recommend users to really navigate through. But again, please reach out to me if you want to schedule one-on-one deep detailed trainings, because this is just highlighting the key features. All right, let's go back and kind of go on. I think Jackie's next. Yeah, turn it over to you, Jackie, for registration portal.
Hi, everybody. So for the registration portal, it's just a reminder that this is for the point of contacts. When it comes to adding and removing the users, this is where that will all be processed. It's our external system. We highly recommend that it is done this way. I know in the past it used to be you email the information in, but once we get it in here, it's automatically populated into our system, and then we can go and build that user ID. So always remember when you're in that RegPass system to use the submit members to the HHIE, that blue button that's kind of circled up there. If it's not clicked, then I won't know that you're trying to make changes. And once those changes have been made and the person is in pending status, you won't be able to make any more changes until we process it on our end. We do ask that you give us 24 hours or 1 business day to process a removal, and 48 hours or 2 business days to process an add to your account. It's usually done a lot faster than that, but those are kind of the guidelines that we have, that we ask that you have. For those add and remove users, our providers are going to need their name, their birthday, their email address, their specialty, and then their NPI and their license number, because it'll automatically be cross-checked to make sure that those are all up to date. If it's just a regular staff or non-provider, then you'll just need the name, the birthday, the title, and the email address. Recently, all of our users, we've been trying to email them directly their information, their login information. That way they have it, but we also will send it to the point of contact as well. There's this little cheat sheet is available in the chat, and it's also going to be linked within this PDF or the PowerPoint PDF that we've created for everybody once this is completed. And I'm going to send it back to Clarissa.
Thanks, Jackie. All right, that 30 minutes went by so fast. We're down to the last 5 minutes. I'm actually staying on schedule. Just some information on the right-hand side of the screen. This is our provider services team. Dr. Rebecca Burton, she's our CMTO. She is amazing at helping with the information that we can and can't offer, what we can do. She's also who trained both of us, so we're very happy to have her as our leader here. And our information is listed below if you have any questions. If you want to schedule a one-on-one training session with your team, please feel free to reach out to me, whether it's with Community Health Record or Notify. And then Jackie, if any point of contacts are on this call, if you need assistance with the RegPass system, if you need assistance adding and removing users, reach out to Jackie. She's happy to help you with that as well. And so we're going to close this out. I do want to say thank you guys so much for joining. These forums are not the same every month. So this will be hosted the second Wednesday of every month, and we will be sending out email blasts to join. So next time we're going to be highlighting new things. So today was just kind of like a get back into the swing of the forums, but the next forum that we host, it's going to be something completely new. I may be demoing Notify. We're going to go over kind of some projects that we're working on. So excited to really bring this forward, and feel free to share with your staff, share with anybody who you think would be interested in joining. And I'll kind of turn it over to see if we have any particular questions. And I don't know if anybody can unmute, but you can put it in the Q&A or the chat as well. Do you see that we have any, Jackie? I can't see where I'm screen sharing.
I already answered Kelsey's question. She had a good question about the data latency time for the data that's shared from our partners. There is no data latency time. The only time that there would be a delay would be if a provider has to approve a transcription report, then that would cause a delay. But otherwise, everything is real time.
Yeah, that's the great thing about it, is it is real time. I've seen, patients, they're notoriously, when they're in the hospital, they get those labs drawn at 4 o'clock in the morning, and they're usually resulted by 6 a.m. And then I come on and do a training at 8 a.m. with an organization, and those labs that were drawn at 4 a.m. are already populated in the system. It's all real time. And that's even like with Notify. If you go onto the portal and see that you've got a patient who is admitted at 2 o'clock in the morning, and you come into your work list and see that your patient was seen in the ER at 2 o'clock in the morning, you not only get that, but you get that bridge over to the community health record, to where you've not only been alerted of your patient's ER visit, you also can see that provider note. As long as it's been signed off by the provider, you're going to be able to see that ER note of what took place during that visit, so that maybe that same day you call the patient, get them back in to schedule an ER follow-up. So really great question about that.
There's another good question. It's how are issues submitted with patient files in HHIE? Because we don't want information submitted through like our help desk, but if you have, I think, encrypted email capability, that can be sent directly to one of us, I believe, and we can explore that, or we can, first, if you want to clarify that further.
Yeah, if you see anything incorrect in the system, it's something I highlight too in trainings, that you guys are often our first line of seeing things that are not showing up properly, or maybe somewhere where there's something in there incorrectly. Send it to me as a encrypted email. So send it as an encryption. If you have screenshots, anything that contains PHI, always please send it over encrypted, and I'll get it with our engineering team to kind of work on a fix for it. Is that everything? Is that all the questions? All right,
That's a good
awesome.
question. We do have one more final question.
Oh, cool.
And it is, let's see, any plans to make records from certain agencies more accessible? The documents review is tedious.
Yeah, so that is an area, and that's why I recommend trainings, because I really take the time to walk through with the users on maybe some key things they can keep in mind to help them find what they're looking for. But we are hoping to upgrade our platform in the future. There's no ETA on it. Unfortunately, I don't have any of that information. But it is something we're looking at as a future update to make the system more user-friendly, especially in that documents tab area. So stay tuned. Maybe that'll be in a forum update in the future. All right, we're at 1 o'clock, so we'll end the meeting here. Thank you guys so much for joining. If you have any questions, please feel free to reach out to us, and happy to have you join today. Thank you.